Okay, so let's get started. Welcome everyone to our webinar, which is together with the one dedicated to the lip volumizer, part of a series designed to explore the practical applications of pairing different aesthetic procedures with the regenerative aesthetic line, the Activate Skin line, as you know, powered by Sigmolecs Technology, which is the Contrad proprietary technology. This innovative approach aims to enhance patient rehabilitation post-procedure and also to improve the outcomes of this kind of procedures. We are very honored to have Professor Alessio Redaelli with us today. Renowned as a pioneer in aesthetic medicine, Professor Redaelli has authored over than 10 books and 35 scientific articles. And in addition to serving as a chairman of the IPAM International Congresses. Today's session will focus on integrating the Activate Skin line, the Actuator particularly, with the CO2 fractional laser procedure, leveraging Professor Redaelli's extensive expertise in the field. So, Professor Redaelli, the floor is yours.
Thank you. Thank you so much, Luca, and thank you so much to Alexei that we worked together, and to Contrad, Swiss company that invited me for this study, I would say, because we did a scientific knowledge using Activate Skin after CO2 fractional laser. And so the scientificity of this study was for me very interesting. I am, as you told, Alessio Redaelli. I live and work in Milan, Italy, and I am a key opinion leader here. I am invited by Contrad, and so I declare immediately my conflict of interest. But as always, I say what I will propose you is not a Bible, even if many things are published, and also this study most probably will be published soon. It is my everyday practice. I do CO2 fractional lasers many times, and I am using these technologies every day. And so I take total responsibility for what I am telling you. So I will tell you some very basics on CO2 fractional lasers, needs and challenges. The wound healing, that is very important and very crucial to have good results, and of course, especially with Sigmolecs technology, we have a particular patient presentation in some case histories, then the summary, and then you can give me and Luca, the super expert by Contrad, all the questions that you will want. Many lasers. You remember that at the beginning, more than 100 years ago, it was invented, the laser, and we have a lot of lasers on the market, from UV to infrared. And what we have used this time is the CO2 fractional laser. And the CO2 wavelength is, as you all know, 10-600, nearby, very nearby, micro and radio waves. Laser in aesthetic medicine is really one of the most diffused. The first always is, as you know, botulinum toxin in all the surveys on the mini-invasive procedures. The second are the fillers. Laser is following these very known procedures, but it is very important in my opinion, and you see that approximately 25% are satisfied with laser procedures, but they have also something somewhat dissatisfied for insufficient results, for the recovery period, for the burning after the procedure. That is not so important, honestly. But you know, for 5, 10 minutes, 15 minutes, finished the procedure, you can have some burning. And of course, the patients come to do CO2 fractional laser for all these problems that very frequently appear in the skin. What is fractional laser? Fractional laser is an ablative laser that is that makes some spaced dots, and the space between dots can be more or less. And is it the same the laser I do and the laser that do other colleagues? Is there any difference? Well, what you do normally can have some differences, and the outcome of a CO2 fractional laser can be different from another CO2 fractional lasers where the colleague uses other parameters, uses other directions. So the way you conduct the laser is very important. We do have a lot of articles, and here you see this article from 2009. So it is not today's that we do the laser, the fractional laser, that is much better than the non-fractional laser. And the fractional laser may enhance many growth factors, particularly the basic fibroblast growth factor, and for example, also the transforming growth factor beta 1. And these factors during the healing process can change the outcome and the final result that will appear, as we know, because the repairing phases are very long, divided in 4 phases, different phases. We have many months to have really the final result. And we can change something, sending some signals to the skin through applying something on the skin. All we know that we have some therapeutic needs, the improvement of skin texture. This is one of my patients and helps me many times. So I know this lady very, very well. And she asked me for this light sagging that you can see in the mandibular edge. And what we can use. We can use, of course, threading, botulinum toxin, fillers, but laser for sure, fractional laser that she did just after this picture. Fractional laser can be a very good possibility to improve the skin, to take care of the skin, not only to lift it, but also, and also we can have a lifting of this skin. So the improvement of laxity can be another very important problem. Improvement of downtime after ablative lasers, improvement of final result. That is another important, crucial. So the skin will be different. The final skin, if you send some messages to the skin, will be better, and the result will be more important after maybe 5 months. And of course, avoid complication and try to get a simple and easy way that is already written for our patients. CO2 fractional procedure mechanism of action is very easy, promotes the synthesis of collagen, and it is a biorestructuring procedure. All you know the difference between biorevitalization and biorestructuration. Biorestructuration foresees an injury in the skin that you make, and immediately the skin starts the healing process. The biorevitalization, you know, that takes care on the normal blocks, but doesn't foresees any injury in the skin. In this case, I am creating a damage in the skin, and this increases, promotes the synthesis of collagen, promotes the synthesis of neovessels. Everything is promoted, elastin, hyaluronic acid, the extracellular matrix that is so important. For example, also when I use, for example, Sculptra, I use polylevulactic acid. I have some interesting results, but the fibrosis is much more. When I use the CO2 fractional, it's totally another. And with CO2 fractional, I have an increase in elasticity and the tissue regeneration over all the healing procedure phases that are the first until the fourth in more than 100 days. And we arrive to the target of our meeting today, the activation of fibroblasts. We don't know exactly what happens, how we can create collagen through the cytokines, through the growth factors, all of these. But the communication activation, in my opinion, remains one first very important step to say to the body, of course, we are speaking about skin, dermis, but very superficial targets, to the widest organ of our body, the skin, to act and get new tissue. Through these steps that are the four typical steps of the wound healing. The first hemostatic phase with fibrogen that is transformed through thrombin in fibrin. The platelets fibrin structure is formed and the growth factors are released. And these growth factors are signaling proteins that we can modulate. The second inflammatory phase that can last around 4-6 days, or we remember that after the wound healing, we have some little pain when we have an injury, edema, erythema, inflammation. Also in this phase, the signals sent to the skin are quite important from platelets that release growth factors, but also white cells, and also all the topical agent that we can apply on the skin around the wound and also on the wound. Then the proliferative phase that lasts 4 to 24 days, around 1 month. You see that if you have a good healing, you have the granulation tissue and fibroblast that lay network of collagen in wound bed, and the wound begins to contract, and so you can have this medical lifting with many interesting technologies. For example, the CO2 fractional laser and Sigmolecs signalizing molecules, Sigmolecs technology that we are speaking about today. And finally, the maturation phase, you see that can last up to 2 years, and so very long phase where collagen fibers are reorganized. And this is very important where we find the first signals in the first and second phase that can affect, can modulate a lot of the maturation phase. And so here arrives what we are speaking about today, what we tried to use in our scientific studies, the Sigmolecs technology that is derived from signaling molecules can send some particular signals to the target biological pathways of repair, and uses biomimetic peptides that are in the matrix of hyaluronic acid that give some particular characteristics that mainly are high stability, penetration across the epidermal layer. So you are sure that penetrate, especially after CO2 laser, where we create some penetration, some holes where the molecules can penetrate better. And Concord, of course, is proprietary of this technology. This activate skin that we use, and this is my machine. And what is inside the activate skin actuator, that is a totally odorless fluid, are some oligopeptides derived from the growth factors, in particular the insulin-like growth factors, the epidermal growth factors, the fibroblast growth factor 2, and interleukin, the polypeptide 42. And so our target was to support the aesthetic procedure treatment, an ablative procedure with a CO2 fractional with good power, so totally ablative laser. And with Activate, we can improve, manage the redness, the swelling that is in the first and the second phase of inflammation, and then also support the proliferation and the remodeling phase after the laser. And so finally, we state that if you use some particular signals that are inside the Activate skin cream, you can improve the final result. And we have a case that is an interesting case that I treated around 1 month ago. And we have this patient that I treated with this energy and with 1 milliseconds and with a spot distance of 11.11 millimeters, of course, before some lidocaine, because this is an ablative laser, and so creates some pain using it. The skin is totally burned, and so there is some smoke arriving from the procedure. With the lidocaine cream, this is not only lidocaine, but it's lidocaine and prilocaine cream. The pain, honestly, is reduced in a very good way. And here you can see the results of and the downtime of this after CO2 fraction. Now, we divided the phase in the first hours, and we used two different products that I use before. I was using before Activate Skin. I was using after CO2 fractional. You see the first hours, and we did this split phase study. From one side, the BFN emulsion, that is a good comparator cream, and on the other side, activate skin. First of all, I can say you that it was very safe. This is the first important important detail. There were totally the problems, and it had instead very good improvement respect the other cream, or at least it was very good. Here you see the before procedure and after procedure. After 10 minutes, 4 hours, of course, the redness comes a little bit more, and 12 hours. On the right, activate, and on the left, biafin. And the conclusion that my patient told me, immediately the sensation he had that were totally no problems, and that activate demonstrates a better smoothing effect and provides a superior relief from burning sensation. Honestly, the burning sensation after CO2 fractional laser is not so much. My patient, of course, is a man, and we know that men always have to complain about pain, while ladies do not have totally any problem. But for my patient, that was a man, and you see, of course, he's a man. This was anyway very important. And here is after 12 hours, we applied on all the face, and here you see the days after procedure. You see the square parts that are burned after the procedure. You see after 5 days, very good results. Normally you take 7 to 10 days, but you see after 7 days with activate skin, the healing process, the presentability of the patient is quite total. So normally nowadays I suggest my patients, if they do not want totally to explain anything to others, that in 5 to 7 days they can come back to their work. So I do the procedure maybe on Monday. Next Monday, for sure, they will come back. Even if you want, you can come back also the day after, because there is some light swelling, but with activate, not so much. 14 days, you see the very good result on the, that is what I say always to make it, the lightening of the patient. The skin is more beautiful, more white, and all the little hyperpigmentations are improved. So this is the best result. The 14 days, both some little remaining crusting, but quite nothing. And so the patient experience that my patient told me was pain relief, reducing redness and swelling, hydrating the skin, and improving finally elasticity, firmness, and brightness. That is the most important detail that I saw. Also, the open pores reduced, and after 14 days, you can see the macro photography, and this is what the patient told me after the treatment, and he used the actuator activate skin twice a day with 3-4 pushes of the cream for side. Of course, the cream must be in a not thick, but in a good quantity to improve this. This male was 49, and you see the power of laser. So you have, we counted and we calculated also with other patients, not only this, some clinical data. And you see the immediate hydration in 30 minutes is 14% more, and in 60 minutes arrives to 18%. The collagen and elastin expression in 24 hours shows a good enhancement of collagen and elastin expression. Here you see the diagrams and of collagen and elastin. And after 7 days and 30 days, the brightness that I saw you and that you saw also in my patient, that was really visible and is one of the best and most important outcomes of the ablative lasers and the CO2 fractional laser. And so the benefits that we saw in rejuvenating the skin that supported in a good way the immediate outcome, redness, swelling, so a good comfort in the following hours and then days. Then it was very quick, the skin renewal, improves the texture. Now we are at around 1 month and a half, 2 months, but enhances hydration, elasticity, firmness, and patients are more confident with their doctors. We have, of course, many other patients. This patient, we tried me directly, but we have many other case histories like this that had a recovery around 30% less using Activate Skin day 1, and here you see day 4 after the procedure, and also other, for example, after Q-switched Nd:YAG lasers for this is for a tattoo of the eyebrows, where it was used Activate Actuator twice a day for 7 days, and she had a very good outcome. These are the photos immediately after laser treatment and after 7 days, totally healed. This is our protocol that we suggest and we used in my patient, and we suggest you to give the patient the prescription, or you give directly the Activate Skin Actuator immediately after. I have mine in my clinic, but you can give to the patients that we use 1 to pumps for each part of the face for 30 days. And so you give them the cream that they will use for 1 month after the procedure. But they can, of course, use like hydrating cream for the day. So finally, to conclude these take-home messages, take care using the Activate Skin Actuator, takes care of the immediate burning, and the first period after the laser treatment will be comfortable and less painful. The signals that you send to the skin, and especially to some particular molecules, are the key to have a quick, but especially better results, and are the right way to heal faster and to finally have a better skin, more compact in the month. So to improve also the 4th phase of the wound healing, and the final outcome seems to be better. And finally, I propose some questions, but now we have finished, and I want to show you very quickly my books that I did many times during these long years of experience from botulinum toxin to facial aging, where I am speaking about CO2 fractional laser, mesotherapy, and so on, medical rhinoplasty, the only one book in the world on the medical treatment of the nose, and the telephone of contract Swiss that you can find immediately. And I wanted to come back to these questions. I don't know if you have some questions, but I want first of all to ask my expert, Luca, that is here with us from a contract company. Are we really sure that these biomimetic peptides really penetrate the skin barrier? Luca, are you here with us?
Okay, so first of all, thank you so much for the great presentation. And concerning this question, which is one of the frequently asked questions about the peptides, the biomimetic peptides in the Sigmolecs technology, how we demonstrated that these peptides can really penetrate the skin barrier. We performed an experiment by Raman spectroscopy analysis, which is one of the main technology used to demonstrate the delivering of molecules through the skin's layers. So we have this experiment that demonstrates that the peptides, particularly the Sigmolecs peptides, can really penetrate not only the peptides, but the mixture between the peptides and also the hyaluronic acids in the form of sodium hyaluronate, which is the salt of the hyaluronic acid. So, and we also demonstrated that in the presence of these peptides, this mixture can enhance the hydration of the skin. So when the peptides, the Sigmolecs peptides, the peptides derived from this growth factor are present in the final formula, we have a statistically significant improvement in the effectiveness onto the skin. So we have an improvement in the hydration of the skin.
Thank you, Luca. I know that also Alexei is here present with us, and what can I say? He is quite our moderator. And I wanted to ask Alexei if we have any question raising from the attendees connected.
Yeah. We have a different type of questions, and I'm proposing to include them even. I mean, in these questions what we have right now on the screen. But before, I would say, Alessio, thanks a lot for this great presentation, and maybe almost, I mean, all people recognize that that patient was me. So I don't want to hide this, because look, I have a medical degree, and for me it was a great curiosity to understand how the product works, what the patient feels, after the procedure, before even the procedure. I would say that what you told about the men and women's, it's right.
I am a doctor, and so my secret is total. So
but
if you want,
being as a patient, I can say that was me, and
okay.
I would like to say that my good feeling during the presentation that I was in very professional hands, and for me it was very nice to feel that a high professional person making the procedure under my skin and guide me during the all post-procedure phase. So if you have any questions for me, like a patients, I can share with you. However, if we can come to the questions, then let's say if you're okay, then I will read one question which come from Elizabeth. It's the question. Just a second. Okay. Great result. Do you recommend to use both pre to build up skin resistance and post, or only post? Would you say post is enough? I mean, with post procedure.
Well, I think that the preparation of the skin with the same product, activate the skin, can be very good, because the difference between a prepared, hydrated skin and of the laser and a skin that is not prepared and so less hydrated is totally different. So normally my protocol is to start 15 days before the laser. The patient arrives the day that does the laser only in the morning, then start to put the activate skin from immediately after. My nurses apply directly, like we did with you, the cream on the face, and they continue applying the cream many times a day, not only twice, because the skin in the first days after the treatment is very dry and so needs many creams. So I say them to use the cream how many times they want without any problem.
Okay, great. Thank you for the answer. Let me ask maybe the first question, which I skipped again from Elizabeth. I mean, before reading this question, I just came back from Monaco, and there are a lot of talk about the exosome technology. So the question is, how is the biomimic peptides with the growth factors with the Sigmolecs technology corresponding compared to exosome technology? And if Luca, if you can answer to the question, please.
Yes, very complicated question, because it depends, because there are a lot of sources of exosome. If we are talking about plant-derived vesicles, we are talking about plant-derived growth factors. So in my opinion, it's another story. When we are talking about exosomes derived from human, we need to consider all the regulatory aspects. So this kind of technology is not yet approved in the US and also in Europe. But considering how these growth factors are delivered in the exosome, we have vesicles. So the penetration is related to the size and also the lipophilicity of these vesicles. With Sigmolecs peptides, the penetration is guaranteed by the structure, by the shape of these peptides. So it's size related, and in the exosomes, these growth factors are included in these vesicles. In the exosomes, you don't really know what kind of growth factors are included in the exosomes. So the variability and also the reproducibility is not the same. In Sigmolecs technology, with Sigmolecs products, we know exactly what kind of growth factors are present in the final formula, and which is the real concentration and the stoichiometric ratio between all the peptides. So we know what kind of peptides, we know the concentration, we know the ratio, and we know how to modify them in order to increase the penetration. And again, from a regulatory point of view, these peptides are approved in Europe as SH peptides. They are synthetic peptides, but this technology, the human-derived exosomes, are not yet approved in Europe and the US.
Well, if I can add 2 words, this is now the incredible wave of exosomes. I didn't see, honestly, I don't have any proof that exosome even exist. I saw a lot of good drawings, beautiful before and after, but I didn't see, honestly, where are the exosomes, if what kind of exosomes we have, really what are the growth factors related to these. So now we spoke, I remember 2 years ago, 3 years ago, about PRP. Then we were speaking about stem cells. A lot of stem cells here. Then nowadays, everything was finished, and we speak about stem cells. For sure, stem cells are more visible, more, I have more idea, because in some kinds of problems, stem cells can do a great job. But exosome, in my opinion, maybe in the future will be something very interesting. But for now, we are still in the very beginning of this era of exosomes. Sigmolecs, the signalizing technology is more clear. and we know exactly what we are applying on the skin and which are the signals that we send to epidermis and the dermis in the first layer of the skin, so where the CO2 fractional arrives, and also especially the signalizing to the vessels, to the endothelium of the vessels, where we have some growth factors, is so important to have new vessels, much more, in my opinion, than exosomes.
Thanks for the answering. We have also one comment about your answer about the pre and post procedure from Elizabeth, that she recommends, I mean, from her point of view, to have like also pre and post, which can give the best results. And my contribution, I remember I participated in different advisory board with different international KPIM leaders. And aesthetic doctors who have a very solid dermatological background, they also recommend to use, let's say, the pre-phase to prepare the skin before the procedure, because every type of procedure, this is like a high stress for the skin. And when the skin is nicely prepared, nicely hydrated, it's nicely tolerated and more faster recovery after the procedure. Then we're coming to the next question about our plans and from Ivan, and I think Luca, that's the question to you. Do you have plans to do more split phase studies, for example, using female models as they stand for 90% of the industry? What's your reply?
Yes, for sure. We will. Now we are conducting more and more clinical studies in order to demonstrate all the results we have seen today. And for sure, we want to do that using female models.
Great. Thanks. Professor, we have one of the question which was on one on your slide, that was, do you have any specific, let's say, requirements for the post-procedure product? Because we know from some references that the post-laser skin is have a heavily the features of much faster absorption of any type of topical products you put on the skin. And even I know from also that sometimes laser use for better penetration of some topical medication. But look into the post-procedure product. Are there any specific attributes for this, taking into account high absorption of the skin?
Well, I ask my patients not to apply any other cream, because all the creams, all the topical factors can penetrate much more. And so I prefer that my patient use only what I ask them. So the protocol is what I showed. 15 days before they apply the cream, they arrive the day of the appointment, they apply local anesthetic cream, numbing cream, and then after the laser, they start to apply only activate skin on the skin. They wash the face without any problem. After 4 or 5 days, they can apply also some makeup without any problem, because the crusting will start to fall down in around from the 5th to the 7th day. It is everything reduced. Also, if you do a strong laser. Many times I have this question: is it better to do one strong laser a year, or maybe 2, 3, 4 sessions? That many times there are some colleagues that use the CO2 fractional laser, maybe 5 or 6 watts and very large holes. I prefer to do one strong laser, maybe every year or 2 years, because the patient has some problems for 1 week. And the results, in my opinion, are better with a harder laser than with a soft laser.
Great, great. I also hearing a lot the same question. Thank you for very interesting answer. And I'm looking to the time, and I would propose if anybody have the questions, you can use also, I mean, the audio. I mean, you can switch on the microphone, and if you want, you can ask the questions regarding the experience or any type of question to Professor Redaelli or to our company as well. Please welcome if you have
Marina.
Alexei, you have
Marina.
skipped my question. As far as I know, activate skin can be built up into our anti-aging skin routine, but our products with signaling molecules are much more efficient after skin injury, or not?
Yeah, with the right injury, of course. So the CO2 fractional is very uniform, and in my opinion, is much better than the normal CO2, the total injury on the skin. So, of course, if you create some holes, you have a very good result. For example, if you don't have a CO2 fractional laser, like many doctors do not have in their office, it is a good, very good possibility use the microneedling. Microneedling is a procedure where, of course, you don't have any heating of the skin. And so the stimulation of fibroblasts is totally different. But anyway, if you do a good improvement, especially around the mouth for cold bar wrinkles, or around the eyes for crow's feet, especially you inject botulinum toxin and microneedling, and Sigmolecs technology, in my opinion, you have incredible results. For example, the perioral area is very good. So the injury in the skin is fundamental, is crucial to have good results. Without any injury in the skin, you can't, for example, remove cold bar wrinkles. You need to CO2 fractional if you don't have, for example, in my opinion, the microneedling has an incredible outcome if you do a good injury with Sigmolecs technology and activate skin.
Thank you very much. Great.
Thank you.
I would propose if there are any last type of questions, please write on the chat, or you can ask as well. I mean, using the
later. No problem. I am here. If you have my my mail, every possible question, we will answer also in next days.
Yeah, I would say then let me close the session. I want to say a lot of things. Firstly, Professor Redaelli, for your great experience and for your sharing the knowledge. I want to say a lot of thanks for Luca for answering the questions and moderating the webinar. And as well, I want to say a lot of thanks for all our attendees. I mean, who came and asking the very interesting questions and sharing their expertise. And what we are ready also to share with you the recording of this webinar. And it's not like we end with this webinar. No, we want also to collect your potential questions, your potential experience, and we are ready to provide you with more and more information with our great key opinion leaders like Alessio Redaelli. So thanks to
you. With our team,
yeah,
that is ready to answer your question and for new ideas. What you said me before the webinar is a very interesting new molecule. We will speak maybe in the next webinar about new activators.
Yeah, because as a company, we are preparing and we inventing a lot of type of products which can be integrated into your day-to-day practice and help you to give a better service to the patient and as well to reinforce your aesthetic result, because I mean, at the end, it's all about the patients, it's all about the services, it's all about what type of unique services you can propose to your patients to make these patients happy and return to you back again.
And I see many names from Japan, and so promise to go in Japan and show our technologies.
So thanks to all, and thanks to all of you